I'm Lucy Common. I'm a consultant nurse in Immunology and Allergy at the Northern Care Alliance. I'm also the clinical advisor for nursing at NICE. Despite challenges with job planning, which many of my nursing colleagues will relate to, I'm sure, and the ongoing demands for direct clinical activity in the NHS, I remain passionate about integrating research in my clinical role. Small projects can drive meaningful improvements in patient care and service quality. Being at the forefront of immunology and allergy means staying curious and committed to evidence-based practice, and research allows me to do that. I've been actively involved in research throughout my nursing career, starting with my master's study on food allergy in restaurants, which was published quite a few years ago. I have contributed to several studies, including abnormal prions in immunodeficiency, the UK PID registry, the 100,000 Genomes Project, including recruiting patients for that, and the NIHR bioresources for rare diseases. Also the COVID study and the BRIT registry for immunotherapy. Research has sharpened my critical thinking and made me more analytical when reviewing evidence. It has also fostered collaborative working. Being part of networks during the COVID study, for example, in the pandemic, has shown how shared research can directly benefit patients during unprecedented recent times. Research has helped me, through that example, it's helped me connect with other centres and contribute to a broader community of practice. Research enhances critical thinking and encourages innovation. It empowers nurses to challenge norms, improve patient care, and create a culture of bold ideas. Including research in clinical roles helps keep practice up to date, allow for thinking outside the box, and ultimately deliver the best outcomes for patients. One major challenge is shifting the perception of nursing roles to include nursing leadership. Despite research being a key pillar demonstrating advanced practice, which I'm sure many of the nurses are aware of, there's huge variation in how much time nurses have ring-fenced for research activities. Realistic job planning and culture needs to evolve to support this, and it's a challenge for all of us in nursing currently. I've advocated for senior nurse support, so from corporate nursing, non-clinical nursing, and good clinical practice training to normalise research as part of continued professional development. As part of my Florence Nightingale Foundation scholarship, I've had leadership and impact training. In fact, I'm going to RADA next week to do further impact training, which I'm really, really excited about, and something that I would never have had the opportunity to do in my nursing career without the scholarship. So I've connected through the scholarship and also working at NICE. I've connected with midwives, corporate nurses, military, research colleagues and consultant nurses across the UK. I hope to explore national and international healthcare practice, leadership and systems, and bring back fresh ideas and innovation to both my roles, aligned with the NHS 10-year plan. I would be bold with ideas. I would try and start, despite being bold, you can start small with like a focus group, approach a charity to see if there's a little bit of funding for you to gather perhaps some patients together. And my biggest piece of advice really is to get someone who's a mentor, like a research mentor, that can be nursing, medical, other allied health professionals, to create space to talk about your ideas. Someone that holds that space for you is really, really vital. And also look locally to see whether you've got a clinical centre for research like we have locally, and they usually call themselves incubators for research.